They did a lumbar tap and they discovered that he had MS, multiple sclerosis. He'd had insurance for years, paid $300 a month, and his insurance premium went from $300 to $700 a month to $1,200 a month to $2,700 a month after the diagnosis of MS. We went through a lot of savings on all the things that insurance doesn't cover, even with having full coverage all along the way. And we've just come to the point where we've just literally logically figured out in 10 years we're going to be out of money if something doesn't change. This nurse had these very high acuity patients, and God knows how many others, 7 as far as I could tell. And needless to say, my husband's care was delayed. I do find a lot of fault with the institution that put that nurse in that position. It was not the quality of care that a patient deserves when they come in the hospital. There was the same experience I had working in the hospital, constantly fighting for the time to do my job properly. I just started talking to legislators in my area and started talking to other people and asked them to start writing letters to their legislators. You automatically got the health insurance and you automatically got the benefits. Other than people have to be aware they're not getting the type of care that they deserve. Set up tables, got signatures, mailed them to legislators, got other nurses in the area involved in working with me. A coworker of mine started telling me a little bit about this organization called the NNOC that seemed to have the same kind of ideas about putting the patient first and being the advocate for the patient. That was interesting to me. Anyone that knows me, anyone that has been with me on this roadshow, those if you're in the elevator with me, if you're behind the counter, somehow I'm going to bring into the conversation the fact that we need to pass House Bill 676.
They've had a national tour. This is one of their tours, and they want to make sure the health care stays on the top of the agenda. Let's give a warm New Hampshire welcome to the...
I've worked my whole life.
Because they're putting profits over human life. So
there is no way an individual, when you get into a health care crisis, can pull yourself out. You just can't. It's got to be the family, the community, reaching out. And in this country, the government, we have to have some type of program in place. My husband planned very, very well. He worked very, very hard. And we are really one of the fortunate ones because we did have resources to pick up the things that insurance hasn't covered. But that is not the case for the majority of the people. You don't know when it's going to happen to you. You just don't know. My name is Deberah Mazala, and I believe every American deserves the right to health care. Every American.